Now, South Africa's institutions of higher learning are readying themselves for the return of students, allowed, of course, by lockdown level 1 regulations, as the December examinations will take place in person. The Department of Higher Education, with the assistance of Higher Health, has developed and released a set of guidelines to ensure that the post-schooling education and training sector is protected from cluster outbreaks. Let's speak now to Dr. Ramneek Ahluwalia, and he is the CEO of Higher Health. Doc, thank you very much for making the time to speak to us here on Newzroom Afrika. So there's going to be more personal interaction, not just among students, but also invigilators who are going to be making sure that they are monitoring these exams as they take place. What is in place around the 26 universities and 50 FET colleges that are out there?
Well, thank you very much, and good evening to you and to all the viewers. And thank you for allowing us to speak to the parents, the students at home or in residence program, trying to ensure that, yes, from the 15th of October, we go into our exam phase. And I think a lot of preparation, which has already been done in order to go to level lockdown 1, to allow every student come back into our campuses for contact learning, accessing our libraries, residences, accommodations, classrooms, and to keep the science of the virus in reality. The virus is around us, it's non-seasonal. We're definitely going to see few more outbreaks in coming till South Africa finds, or the global world finds, a vaccine or a herd immunity in particular. So keeping the science of how long does the virus survive on a surface, which is a paper, on a skin. We already know the science has clearly shown that the virus can live on a soft tissue, which can be a cardboard or a skin, from 6 hours to 12 hours. Keeping every science into mind for the virus surviving on a hard surface, ensuring that when we are putting a protocol on cleaning or disinfection prior to preparing a classroom or preparing an examination center. So the protocols, systems and controls needs to be put on before the exam, during the exam, and after the exam. So I think we've got about 13,000 frontline workers across post-school education system that we've developed over the last 6 months. They're working day and night towards ensuring COVID infections are minimized in our settings of post-school education. We are campuses which are thousands and thousands of students and staff at one time entering into our programs, into our gates, congestion at the doors. So I think it's very minute towards understanding how we prevent the virus, right from avoiding congestion at the gates. How do we systemize students coming in? How does the invigilator prepare the examination booklets, and how we sanitize the booklets, sanitize the hands before it's distributed, the role of picking the exam papers, invigilating the exams, and of course from there for a small period of quarantine before they go into invigilators towards checking the exams. So right from the beginning till the end, and also keeping in mind the engineering part. So it's not about wearing masks and wearing gloves, but because it's airborne, it's droplets, we have to keep in mind the building structures, whether there's proper ventilation in the room, the windows are not jammed. And so it's going to be a very 360 review of how we conduct the exams and how we go through it. But I want to pass on this information to all the students listening or parents that a lot is going to be prepared, it's been done. We need their support. This virus cannot be fought without them. A social compact is needed where students also support management towards ensuring they're wearing the masks, they're sanitizing their hands, they're also ensuring their own protection. So it's going to be a balance of the world where we can win this virus.
Yeah. Doc, I mean, you've touched on all the areas that I wanted to quiz you on, but let's go back to the virus being airborne. The assumption is that you are going to have these examinations taking place in enclosed spaces. Ventilation. How well ventilated are the campuses going to be, particularly in the examination rooms?
So definitely, if you look at our protocols and our systems, the first big part is the engineering part. The management has to select examination halls or centers which are very well ventilated, which has windows, access to cross ventilation of air. Remember, this virus, if you are 1.5 meters away or 2 meters away in physical distance, if you're wearing a mask, it's actually very minimal if you're not touching or you're not shaking hands or you're not touching the same surface where your hands are. If you look at the science, it's very difficult then the virus to move from one individual to the other, even when you're coughing or you're speaking in one person to the other. So the cross ventilation then eventually helps towards dispersing the virus, not letting it being into the droplet form and moving from one place to the other. So one person to the other. So air ventilation, windows, air conditioning, removing of filters. If there are old buildings with old air conditioning, we are not using them for even contact learning or for the examination. So it applies not only for examination, but also for contact teaching and learning. So these are principal guidelines which have been built through a lot of scientists from mechanical engineering, from architecture, from occupational health perspective. So it's about public health. So these are people who have put together what is right for the building to be utilized for contact learning.
Yeah. You spoke about personal responsibility, Doctor, and that talks to people being responsible, wearing masks and sanitizing and, not getting too close to one another. But I want to ask whether there has been any, I think what you would call exception that's been made for those students who have serious comorbidities. Are they going to be forced to go and write inside a university hall, or can they do their examination at home, online, for example?
So we're trying both ways now. So remember, we've got campuses in Bizana. We've got campuses in Ladysmith. We just don't have UCT, Wits, or University of Pretoria. We've got a campus in Butterworth in Walter Sisulu University. And plus, as much as we've got TVET colleges and universities, we also have community education training colleges. In fact, I would like to let the viewers know we've got 1,800 centers of community education training colleges around our country supporting our communities. So yes, absolutely, it's going to be a balance between online examinations versus on-site examinations. Provisions have to be made for people with extreme comorbid or conditions where there are uncontrolled comorbidities. The good part is we are young people, and young people, the realities of this virus affecting you is far minimal than compared to people with 45 or 55 above with comorbidities living. And that's as per the science perspective. But you're right, absolutely. I am fully in agreement. There's a small population who is highly volatile or vulnerable to the coronavirus with comorbidity, even in young population who will be coming to exams, and special provisions are being made for them, their exam conduction, either in more secure spaces or in an online perspective.
Yeah, finally and very briefly, Doctor, I know that you've also created a toll-free crisis helpline for those students who might experience anxiety or just stress levels being in a room packed with people and, you're not sure just how safe you are. Tell us about that helpline quickly.
So I'll start with the number. So every student, every staff in South Africa in the post-school education, note this number called 0800 363636. Now the reason I started with this number is you're 2 o'clock in the night, 3 o'clock in the morning, 3 o'clock in the morning, or in the daytime or in the evening when you're alone and you're anxious, you're depressed, you are you have crisis of trying to commit suicide. It has been a difficult year. It's COVID. It has not been normal. There have been enormous stresses. South Africa is a country where poverty is extreme. We've got gender-based violence in extreme. Mental health is absolutely on the rise. Not only because it's the World Mental Health Day, but because exams are coming and young lives are highly prone and susceptible to mental diseases. Call this number. 24 hours, there's a psychologist, social workers, counselors trying to help with our South African Depression Anxiety Group, SADC. The aim is you should not be finding yourself alone. We should solve the crisis together. And then, if you need further help, then the referrals will be to clinical psychologists, which we have hired as higher help, or universities, or TVETs, or counselors. But that's a chronic stage of supporting you. But acutely, mental health cannot be left alone. Right. And I think this is a very important message through you.
All right, Dr. Ramneek Ahluwalia, he is the CEO of Higher Health, and that toll-free number, again, if you missed it, it's 0800 36 36 36. Doctor, thanks indeed for your time. Much appreciated. In just a moment.